The coronavirus or viruses is actually a group of, well, a family of viruses that's been around for a while that usually, under normal circumstances, only affected animals and birds. However, what we're dealing with now is COVID-19 or coronavirus 2019, which is zoonotic, which means it can be transferred from animals to humans, which is what seemed to have happened in Wuhan, China back in December 2019. Well, the symptoms have a range. They can range anywhere from mild to severe. Again, the coronavirus has been around for a while, and it can actually cause the common cold. You know, some of us in the past may have come in contact with the coronavirus before and have only suffered mild ailments. But what we're seeing now with the COVID-19 is that patients usually are starting to present with fever, shortness of breath, cough, headaches, malaise, maybe some sweating, fever, chills, which is kind of hard to differentiate because, again, this is also flu season, whereas the flu presents almost the same. You know, and then for those individuals who are presenting with mild symptoms coming across as like a cough and maybe a stuffy nose, similar to the common cold. So for someone who is maybe on the younger side and relatively healthy, they may just have like maybe a cough, maybe a mild fever, but someone older who may have certain health conditions may go into a full, they can have kidney failure. They can also have severe acute respiratory distress syndrome.
Right.
Well, from what we know right now, what we theorize is that it's spread through droplet precautions. So if you come into contact with someone who has the virus and they were to cough and sneeze within 6 feet of you and it goes into your respiratory tract, i.e. your mouth or your nose, then it can enter your bloodstream, into your body, and it can do its damage. There's also theorized that maybe it might be airborne, which means that the microbes may actually be able to float in the air and get into your respiratory system that way. Prevention is actually pretty standard. It's something that we've been going over for years when we talk about flu and the common cold. Hand washing for one, wash your hands for at least 20 seconds, especially if you just come from outside or you just came from the gym or doing something like that. When you cough and sneeze, make sure you do it into your arm sleeve or preferably a towel or some tissue and then discard that. You also want to disinfect your surfaces. So we have Lysol spray, disinfecting wipes. There are also Fabuloso disinfecting wipes. If you actually look on the label, it can actually say that it kills coronavirus. And if it doesn't say that, you can just contact the manufacturer or look on the website to see if it's effective against coronavirus. Again, you want to wipe down the surfaces such as doorknobs, your office space, your desk, computers, even your cell phone and keys, anything that comes in contact with human contact frequently, especially from the outside. Well, let me start off by saying that COVID-19 is infectious to everyone. So there's this stigma going around that it only affects a certain type of ethnic group, which is not true. Anyone and everyone can be affected by this virus. But what we're seeing is that those who are more susceptible tend to be the ones who have to be hospitalized or suffering from the more severe symptoms. These are people who are the elderly, those over the age of 65. These are people who also have certain health conditions such as diabetes, high blood pressure, heart disease, people who have compromised immune systems, which means that their immune system is weakened and they can't fight diseases and infections like someone who doesn't have a compromised immune system. So these people are people who have cancer, people who have HIV/AIDS, people who are taking certain type of immunosuppressant medications. Well, I'm not going to say that it's not serious. However, I will say that there is a lot of information that is a little false out there, so definitely be careful what you read. But looking at the statistics, the mortality rate for the COVID-19 has only been about 2-3%, which means that of all the people who have come in contact with the virus worldwide, only 2-3% of people have actually died, whereas 97 to 98% of these people are still alive. These people, not all of them have been hospitalized. Some are being treated at home, and some of them have actually recovered. So compared to other diseases we've come in contact before, like SARS, which hit China back in, I believe, 2002, and Ebola, which had a 70% mortality rate, which hit a couple of years ago. So I'm not going to say that it's not serious per se, because as I said, those individuals who are immunocompromised or have weakened immune systems definitely can suffer on the harsher end of the spectrum of this disease than those who don't. What I will say is that we have to do our part as just regular people who go out into the world and communicate and interact with each other. So again, wash your hands. If you're feeling sick, stay home. Don't go to school, don't go to work, disinfect your surfaces. This disease does have an incubation period of 2 to 14 days, which means from the time of infection to the time you show symptoms could be up to 2 weeks. So you can actually have already been infected with the virus, but you don't know. So that's why the CDC and the World Health Organization recommends that people who may have come in contact with COVID-19 isolate themselves from your family, from your friends, preferably within your own room or your own section of your house, for at least 2 weeks, just to make sure that you're not showing symptoms. And keep in mind, this is flu season, so just because you're coughing and you're sneezing doesn't automatically mean that you have come in contact with COVID-19. If you do have any symptoms at all, just contact your healthcare provider. We do have screening methods to rule out other respiratory illnesses that could be causing those symptoms, and then we'll look at corona.